For me, it's spiritual. You look into a baby's eyes, it's a pure form of life. They're helpless. They're depending on you. Andrew Dorough, DC, chiropractor. If you would have told me that I was going to be an infant chiropractor 10 years ago, I would have thought you were out of your mind. I kind of feel like in a way it chose me. I know it sounds kind of cliche, but I discovered chiropractic care at a very early age because my neighbor was a chiropractor. I was 19 years old, had no idea what I wanted to do with my life, and I decided to job shadow him for one day. And he used this instrument right here behind me, the Sigma instrument, and he gave me an adjustment with it. Little to my knowledge at that time that I know that the symptoms I had been experiencing, neck pain and headaches, were actually coming from a neck issue. And that's when I started to realize that there is a gap in healthcare. There aren't a lot of drug-free treatment solutions to help these kinds of conditions. This care strategy behind me is what offered the most effective long-term relief from the condition I was suffering from. And so that point, it caught my attention, and I said, gee, maybe I should do this myself. I can understand it. I relate to my patients. And then that just brought on this cascade from there. That's probably why, being a patient myself, suffering from headaches and neck pain myself from a head injury I had, that realization, I think, incentivized me and pushed me to give more care to the pediatric and infant population. And so what I do in my office really isn't that much different from other chiropractors. I think it's my approach and how I speak about it and my expectations from it. Specifically, this instrument tends to cater to people who are fearful of that manual or rigorous manipulation that a doctor of osteopathy could perform or a chiropractor. I try to practice the most safe, effective, and research procedure. Our goal and position as doctors is above else do no harm. And that's why I chose to invest time, money, and training into this instrument so I can do no harm. When I receive a special needs patient, I want to make sure that my care is going to be either safe and appropriate. So when I receive a special needs patient, I'm assessing their joint mobility. Why are they seeing me in the first place? What will my care strategy be? Because most of the kids that are special needs are typically nonverbal or unreliably verbal. You have to be very objective, very careful, very gentle, and very strategic. I try to, meet them where they're at and go with their flow. And I choose the safest, most direct, efficient way to give care to their spine and nerve system. That way the parents' expectations and desires are met as well. I think that anyone who chooses to give care to babies probably has some likeness or love for protecting them. Myself, like other infant chiropractors or like pediatricians, we have this inherent need and purpose to protect the most vulnerable population in the world, which would be our little baby blessings. For me, it's spiritual. You look into a baby's eyes, it's a pure form of life. They're helpless. They're depending on you. It's like your child looking up at you as a mom or a dad asking for help. It hurts me when I see a parent come in and they're not enjoying a little baby, and I don't blame them. So I feel propelled or, compulsed to help them as best I can. And I'll do whatever I can. I think that now, being a doctor and a dad, I'm on both sides of the fence. I practice now as if every child is my child. Because if I would have brought my baby to someone else like me, and I didn't do what I did, I would have hoped that they would do the best thing for my baby and not for their pocketbook. That's my guiding principle. We all suffer, we all have pain, we all have stress, we all have anxiety, we all feel the pinch of life. And I know how I feel when I have a grumpy neck or a headache, which I was a neck pain headache sufferer. Thankfully, I'm not anymore. So when I see a patient that went from having pain to feeling good and functioning and being a good parent or being better at their job, whatever the job might be. Maybe I've seen surgeons. Now that we had their neck feeling better, they can do a better surgery. So I'm able to impact lives beyond my own office. What keeps me coming back for more is, like I said, pure joy. I feel like I have a purpose. Even though it's a very difficult track, the emotional reward and the long-term benefit of enjoying your workplace, I think, is what kept me going back. Now, training other doctors to do the same thing in their community all around the world brings me even more joy. It's about getting families quality, reliable chiropractic care and giving my profession a good name. All I'm trying to do is do a little bit better than Andrew Dorough did yesterday. So what do I do differently from other chiropractors? I think what I've been told is I spend intentional time with them. I'm careful. I respect their desires. I respect their financial position. And I try to give them the most cost-effective care in the most cost-effective setting that's sustainable and reliable, safe and comfortable, giving someone quality care that is accessible. I think that if I could leave my profession a little bit better than I found it and help more babies, help more people, help more babies. By the time I retire, I'll be a very happy man.